You're watching TV9 News and I'm Prajwal D'Souza. For the first time in the second wave of COVID-19, the death toll in India has crossed 1,300 mark. The country reported over 2.3 lakh cases and 1,341 deaths in the last 24 hours. Before I tell you about an important study by Lancet, I want you to take a look at this graph. Here, I will be focusing on the month of February, March and April. In the month of February, the mortality curve was relatively flat with the country reporting an average of 95 deaths per day. As we moved to April, the curve started to ascend and by April 13, the death toll crossed the 1,000 mark. If the trend continues, we might soon see that the death toll might cross the 2,000 mark. This is where the study by Lancet comes into play. Now, the journal in the latest study has predicted that India might see nearly 1,750 deaths by COVID-19, which might rise approximately to 2,320 by the first week of June. The study also pointed out that the second COVID-19 wave has been geographically clustered so far. Comparing it to the first wave, the number of districts that comprise of the top 50% has dropped from over 40 during the first wave to 20 during the second wave. The study also highlighted two important factors in the second wave. The first is that the rate of the increase in new cases has been significantly higher when compared with the first wave. For the cases to increase from 10,000 to 80,000, it took less than 40 days when compared to last September, it was 83. To understand the trend better, I spoke to immunologist Dr. Tripti Gilada. Doctor, according to you, what are the reasons for this exponential rise in deaths?
We've reached 2 lakh cases in a span of 40 days, which means that the curve is fast rising and we might still keep increasing for the next few weeks. Even with these numbers, the healthcare facilities are already overwhelmed. The hospitals and the ICUs are full. There is a wait list across several cities, even tier 2, tier 3 cities and towns. And I think that is going to be one of the main reasons for the rising number of deaths that we are seeing and that we might continue to see over the next few weeks.
The death toll rose exponentially in the past week. Do you think we might see close to 2,000 deaths in the coming weeks?
The Lancet study stated that we might see 2,000 deaths per day, and with the trend that is being seen right now, it might just come true. The main reason for this very rapid rise in the number of cases is believed to be because of the new variant of the coronavirus during the second wave, which we all believe is the double mutant strain, which is extremely infectious, much more infectious than the previous strain that we were seeing. And since it is infectious, it gets transmitted very quickly from one person to the other. And since majority of the people are either symptomatic or mildly symptomatic, they do not know that they're transmitting the infection.
With the resurgence of COVID-19, do you think we should go for double masking? If yes, can you explain in brief how to double mask?
It will have to be a multi-pronged approach. The three most important things remain the same: masking, social distancing, and hand hygiene and cough etiquettes. There is a lot of discussion about double masking. What we need to understand about double masking is that the benefit of double masking that has been seen in a study is not because of adding a few more filtration layers. It's more because two masks might be more snugly fit than one mask, which means that even if you wear one mask which fits very well, it will be good enough. So what's important is not a single mask or a double mask. What's important is a very well-fitting, snugly fit mask. And when we say that, we mean a mask that goes from the nose to the mouth, the chin, covers this entire area, and also seals the part almost going close to the ears.
Does the current trend in numbers raise a significant need for stringent restriction by the authorities?
Newer vaccines and also by expanding the criteria for the population that needs to be vaccinated. We will have to start including the younger folks in our population, because these are the people who are the conduit between the outside, so the workplaces, the socialization places, and their homes. And until we do not vaccinate this young population, we will continue to have ongoing transmission of infection.
Apart from the death toll prediction, the study also highlighted key solutions to control the spread of the virus. These include increasing vaccination by covering the younger population based on the supply, increasing the vaccine stockpile, ramping up vaccine manufacture, addressing the vaccine hesitancy among the public, no blanket lockdown, among other steps. The current trends are indeed worrying, and it is important that you stay safe and follow all the safety protocols. If you like this content, do give this video a big thumbs up. Don't forget to subscribe to TV9 News on all the social media platforms. Thank you for watching and stay safe.